Hi, my name is Makenna Gooch and I'm going to be presenting the topic of schizophrenia. In this presentation, we are going to go over exactly what schizophrenia is, some symptoms, causes of this disorder, diagnosis, as well as treatments. So, just to get started, what is schizophrenia? Schizophrenia is a serious mental disorder in which people interpret reality abnormally. It affects how people think, behave, and feel. It causes people to feel as if they are out of touch with the world. It affects how people perform everyday tasks. Some symptoms of schizophrenia include delusions, hallucinations, abnormal motor behavior, and other negative symptoms. So, with delusions, these are false assumptions that people feel as if are happening in real life. So, these things are like when somebody feels as if they are being harmed. So that could mean that they're just walking around at school and they feel like somebody is just like on their back about to get them. They're just having a delusion about what is happening. With hallucinations, they align really closely with delusions, but this is more when people see and hear things that don't exist. So this could be like hearing voices, which is the most common form of hallucinations. They might hear a voice of somebody who might have passed away a few years back, so things like that. But they all are not actually happening. So with abnormal motor behavior, this includes communication and thinking clearly. Thinking something really clear in their head and then communicating what they are thinking is really hard for somebody that has schizophrenia. Behavior is also very altered, which is considered a negative symptom with schizophrenia. It really shows with the resistance to do certain tasks. They have inappropriate responses, and they also neglect certain everyday tasks such as personal hygiene, and they also have a lack of emotion. Like, it's really hard for them to show. Maybe their friend just had somebody pass away. It's really hard for them to convey how they are feeling sympathy and empathy, but it just doesn't show. Excuse me. So with the causes for schizophrenia, one of the most common causes people think that leads to the diagnosis is genetics. So while it's not one specific gene in that person's DNA that will cause the schizophrenia, they think it's more, or scientists think it's more of a combination of genes that will cause schizophrenia. Another thing is brain development. Having certain brain structures will generally lead to the cause of schizophrenia, but it doesn't necessarily mean that if you have those structures, you will develop schizophrenia. Other things are triggers such as life events, stress, and possibly just doing drugs can lead to being diagnosed with schizophrenia. So moving on to more of the diagnosis perspective of it. So the steps that they go through are as listed, or as I'm going to tell you. The first step is generally ruling out other mental illnesses. So doctors generally just want to go ahead and before they tell you like you have schizophrenia, they want to rule out other medical conditions, mental illnesses, and possibly any other substance abuse cases because it could overlap with the schizophrenia. So after ruling out that, they generally go on to medical or physical examinations such as MRIs or CT scans. They also do psychiatric evaluations to look at your thoughts, your moods, to see if you have any of those delusions or hallucinations, like mentioned before with those symptoms. They also just want to see if you have any history of substance abuse or suicide, or suicidal thoughts or actions. So, with treatment, there is not exactly one cure that will treat schizophrenia, but there are treatments that can help manage these symptoms. So some of these include antipsychotic medications, psychosocial treatments, and then there is a ton of support groups such as family and educational support, and just like different groups you can attend to help manage those symptoms. And then they also consider alcohol and drug treatments to help manage that side if you were experiencing those symptoms with the disorder. So in conclusion, schizophrenia is a very serious mental disorder. It alters the reality of the person that is experiencing it. Generally, those people experience delusions as well as hallucinations, and sometimes they have a history of suicide. and altered motor behaviors. Like mentioned before, there's no cure for this disorder, but there are many treatments that can help manage those symptoms. Thank you for listening to my presentation. Have a good day.